And this is not your typical antibiotic, I can't even think of the antibiotic name, erythromycin. This is not a typical antibiotic that you take for when you have an infection. These are high-powered antibiotics that address the cancer growth by changing the DNA inside the cancer cell and keeping it from growing multiple times. It also addresses the angiogenic process of a cancer tumor. So angiogenesis is basically the calling of blood vessel cells to the cancerous tumor because it actually needs a blood supply to grow. So cancer works in a very sneaky way by using your body's own defenses against itself and allowing angiogenic processes to begin. So if you look at a cancer tumor on a scan, for example, you'll actually see little blood vessels going into the tumor and feeding it from within. Before a cancer can grow bigger than 3 millimeters big, it actually has to have angiogenic properties occurring. Now, some people's bodies actually resist this angiogenic process, and these patients are less susceptible to developing metastasis and even primary cancer. So we're learning about these people's DNA and these anti-angiogenic factors and trying to determine how can we replicate this in a patient that has metastatic cancer or primary cancer, because if we can stop it from growing more than 3 millimeters, it's not going to be life-threatening. It's not even going to be something that's going to cause a whole lot of harm. So that's something that science is really focused on right now, trying to address that piece of it.